Aphorism 215. Almost all the so-called mental and emotional disease are nothing more than corporeal disease, in which the symptoms of derangement of the mind and disposition peculiar to each of them is increased, lest the corporal symptoms decline more or less rapidly, till it at length attains the most striking one sidedness, almost as though it were local disease in the invisible, subtle organ of the mind or disposition. Sudden outbreaks of insanity or mania, precipitated by some exciting factors, fright, vexation, mental shock, abuse of spirituous liquors, etc., may occur during the ordinary quiet course of disease. Examples for Aphorism 215. A case of suppuration of the lungs becomes transformed into insanity, wherein the physical changes improve almost to perfect health, or a case of chronic colitis becomes eventually transformed into hypochondriasis or some other varieties of neurosis, with the decrease of gastrointestinal symptoms to almost a negligible degree. Second example. There is another condition where the mental aspect is primarily deranged, and these disturbances finding the body slightly yielding to the altered psychological conditions maintain the body in a disturbed condition and continue the psychopathological state of the patient. There are also continued in a viscous circle by emotional cause, such as continued anxiety, worry, vexation, wrongs, and the frequent occurrences of great fear and fright. Third example. There are another group of mental cases where it is difficult to ascertain whether the mind or the body is primarily at fault. There may be corporeal causes or psychological factors. Example, faults of education, bad habits, corrupt morals, superstition, ignorance, etc. Example, sudden outbreaks of insanity or mania precipitated by exciting factors, example, fright, vexation, mental shock, may occur during the ordinary quiet course of disease. These may be compared with the sudden flarings of latent sora in physical diseases.